Okay. So we move the second type of loose connective tissue, that is the adipose tissue. When you talk about adipose, just to think about the lipids. Okay, so when you talk about adipose tissues, we are thinking about a specialized form of areolar tissue with abundant fat cells. Okay, so it's basically loose connective tissue, but what is actually there are the fat cells that are in abundance. Okay, so these fat cells contain fat droplets, basically. That is what basically occupies the center, okay, of these cells. So this pushes the cytoplasm and the nucleus to the peripheral, to the side. Okay, so that means that these adipocytes, or these fat cells, are basically specialized for fat storage. Okay, underneath your skin, you have a lot of adipocytes there, and they actually vary in size. For a person who is very thin, the adipocytes are actually very small. For a person who is fat, the adipocytes are actually large. Okay, these adipocytes cannot divide. Okay, so it is not that when you have a person who is fat, that their adipocytes are actually dividing, and that's why the person is actually becoming fat. It is because the individual fat cells are actually the ones that are increasing in size. Okay, so we find adipose tissues around important organs, and they play an important role for protection. But again, we said the primary role is basically for storage of fats. But you don't want to have your important organs being surrounded with a lot of fat. That can again be problematic. And this is what happens when you have very fat individuals, overweight individuals, that some of this fat will accumulate around important organs of the body, and that can compromise their metabolic state. Okay, so we have two forms of adipose tissue: brown adipose tissue and white adipose tissue. They have specialized functions, and you need to check this out. See what's the difference between the two. Okay, what should you ideally be having? Is it white, or is it more of white? Is it more of brown? What are the implications? So adipose tissues, we said that for protection, especially shock absorber, the fat actually energy reserve is saying that these adipose tissues contain a lot of these fat droplets, and therefore if the body needs energy, these fats can be mobilized. That means that they can be converted into triglycerides and then metabolized to produce energy. But again, also this fat is very important for insulation. Then the last of the three types of loose connective tissue is what you call reticular connective tissue. In here, the major thing is about the reticular fibers. Remember, we talked about three types of fibers. And for the three types of loose connective tissue, we have been looking at the major component for each. And here we are saying that the major components are the reticular fibers. These provide structural support. So they are very small. That's what we mean by saying they are fine, and they are thread-like. We can find them in blood vessels, nerves, and muscle fibers. Okay, we can also find reticular connective tissue in lymph node, spleen, and then the liver. On the screen, you have an image of the lymph nodes, and in there, you have reticular fiber. So you have reticular connective tissues.